Hi, I hope you're enjoying ASCO 21. I have the pleasure to briefly present to you a poster titled Differences in the Tumor Genomic Landscape between African Americans and Caucasians Advanced Prostate Cancer Patients by Comprehensive Genomic Profiling of Cell-Free DNA. My name is Pedro Barata. I'm a GU medical oncologist and an assistant professor of medicine at Tulane University, New Orleans. As you probably noticed, ASCO GU is highlighting a lot of racial disparities in advanced solid tumors, including prostate cancer. And our work is kind of in that direction, or inside that group of research has been increasingly important in the last few years. So basically, the data that have been emerging has shown suggested differences in the tumor genomic profiling of Black men compared with Caucasian men with advanced prostate cancer. And so we hypothesized that there would be different or significant different changes in the tumor genomic landscape between these two populations in regards to what's present at the liquid biopsy level. So that we embark on a real-world comprehensive genomic profiling of liquid biopsy, taking circulating tumor DNA from metastatic prostate cancer patients treated at 6 different academic institutions in the United States. We took the first circulating tumor DNA panel results that were reported by the commercially available assay Garden 360, and we used a 73 gene panel for these analyses first. Additionally, we separately analyzed the 74 gene panel to identify the CDK12 mutations that were not detected in the 73 gene panel in an independent cohort of advanced prostate cancer patients. And finally, we conducted, the Bernard test analysis, but also Bayesian network analysis on the to assess probabilistic assessments here in terms of the association between genomic alterations and race in these cohorts. So, so identify a total of 552 individuals, of which 125 were African American and 427 were Caucasian. And the total number of patients were tested by Garden 360 using the 73 gene panel. As we could see in the table provided, we found a number of genomic alterations that were enriched in African American population, including the AR gene, for example, BRAF, BRCA1, etc. We did find, as expected, pathogenic or likely pathogenic genomic alterations in all cases, actually, and more frequently, the usual suspects included TP53, AR, BRAF, PI3K, CDK, MYC, EGFR, MET, and FGFR1. Just specifically looking into targetable alterations of interest included DNA repair gene defects such as BRCA2, BRCA1, ATM, PI3K, and PTEN. And then we look specifically to an independent cohort of 261 men with metastatic prostate cancer, including 106 who were Black and 155 Caucasian, that were tested using the 74 gene panel. And in these independent cohorts, we found that CDK alterations were significantly enriched in the African American population with 9.4% of the time, compared with less than 2% in the Caucasian population. What was interesting to us is the fact that we confirmed these results in the Bayesian figure that we provide, and basically, kind of confirm the differential genomic profile of African American compared with Caucasian in this data set. So in summary, our study kind of goes along with other studies that have been showing and suggesting significant differences in the tumor profile between these two by race, between African American and Caucasian. And it's definitely important to, further identify these molecular drivers of tumor progression who may be enriched in African American population and may actually allow developing of tailored systemic therapies for these individuals and ultimately decrease disparities in the disease-related outcomes. So thank you again for your attention. And I wish you a very good meeting, and I hope looking forward to see you in the near future.